For our next video, we are going to show you how to set up an atrium dry suction water seal chest tube setup. Obviously, the physician is going to be placing the chest tube. Your job as a nurse or a medic is going to be to have the atrium set up all ready to go. So once the trocar is placed, you'll be able to hook it up, have it ready, all ready to suction, so that we can have a seamless transition. First thing you're going to do is obviously gather your supplies. You're going to need an Oasis dry suction water seal chest drain. There are both adult and pediatric. This is what it looks like out of the package, and we'll go over it in more detail in a minute. The physician is going to choose whichever trocar he wants, obviously depending upon the size of the patient. A couple of different types of tape. I recommend using Durapore tape for your chest tube dressing securement, and then silk tape to use to be able to connect your trocar to your chest tube setup. You'll also need a chest tube insertion tray for the physician to use. All of these can be found in the trauma room in the compartment next to where all your Artline stuff was. So you'll notice that you have chest tube insertion trays, you have trocars, above that you have your adult Oasis, and up top you have your pediatric. Kathy's going to have to jump if she wants to get to that one. You also have pediatric trocars up there, and then any other additional supplies like tape or any dressing supplies can obviously be found in your procedure cart. Alright, now that you know what equipment you need and where that you're going to get it, we're going to go through the actual setup of the chest tube. We already have one setup that's open, so we're going to go ahead and utilize that. So once you remove it from the packet, I want to go over some of the key features that you'll see on the Oasis suction setup. One of the first things you'll notice is the dial where the orange arrow is. Kathy, you can adjust the suction to whatever level you want. Obviously they're going to want it usually at 20 centimeters. I'm going to angle off here, and you'll see there's a small baffled that pistons in and out depending upon the suction setup. So when you apply suction, you want to make sure that that billows all the way out to the little green line that's right there, the arrow. You'll notice that you have an air leak check system where the fluid will be filled, and we'll go over that. You also have all of your numbers for accurate I&O. If you turn the set over backwards, or the back side of it, you'll see that you have your tubing itself, and Kathy's going to go ahead and take that out and just lay that on the bed. It is already pre-attached. Something that is of note is that this has a quick disconnect feature. You just push the button and the section comes apart in case you need to change it. You also have a port to be able to access for sampling if they need to take a sample, and you're still able to maintain sterility without breaking any of your circuit. Also on the back of it, you have your pre-filled water syringe that will be used to set up your water seal. At this point, we're going to go ahead and turn it back around so I can look at the front. And what you will do is you are going to open up your water by twisting the tap off. That will be inserted directly into the suction, just jam it right in there, and then you are going to go ahead and squirt the entire contents into that setup. And you will see that it is filling up the bottom of this. You can gently agitate it from side to side. The little ball has all the blue dye on it. The nice thing about this dry setup is that you can't spill it, okay? But you'll notice that your water is at your 2 centimeter line. That's important. You also have some gauges there. You see number 1, 2, 3, 4, and 5. Those are varying grades of the air leak, and we'll demonstrate what an air leak looks like shortly. On the top of the setup, you have your hooks that you can use to hang off of the bed rail. Also on the bottom, you have a swivel leg that kind of comes out that can be used so that you can place it directly onto the floor or wherever you happen to be working. So at this point, we already have our setup completely ready to go. The only other thing I would recommend is you can, if you want, there is a slide clamp on here that if you need to clamp your chest tube, you can. I don't recommend you regularly clamping it because sometimes people forget and you can cause all kinds of crepitus problems. At this point though, we're going to go ahead and hook our chest tube back up to wall suction so that you can see what it looks like when it's hooked up to suction. So, Kathy, you don't need to do anything with that. that's going to hook up to the actual trocar. You're going to take the wall suction itself, and you're going to hook that right to where it actually says suction, where you put the water in. You're going to hook that up, and then you're going to turn your suction gauge on, and you will see, since it's set at 20, turn it to continuous, there you go. You'll see the billow actually comes out, demonstrating that it's right to the green line. You'll also notice there's a lot of bubbling going on down there. The reason being is this is the suction now, and our catheter is not hooked to anything. If you clamp it, like I just did, you can see that now there is no bubbling. So when you have a patent system hooked up to a patient who does not have an air leak, that is what your water fill line is going to look like. If it's hooked up and it's correctly hooked up and it bubbles like this, it means that the patient has an air leak in their pleural cavity. Obviously, that's why we're placing one of these in a patient. A couple other reference points to mention. One, if you're placing this and you haven't done it in a while, please reference policy and procedure. You have, as alluded to in the arterial line, you have policy stat that you can check. You also, if you cannot find a policy on a procedure, the next choice is to go to the nursing portal and look it up in the Lippincott reference section, which is under your policy section. The other thing, once this is placed, so now that the chest tube is all set up, the physician has placed the trocar, you can go ahead and turn suction off for now, Kathy. The last thing you're going to need to do is when the physician places the trocar, you're going to need to hook it up to the actual tube. So Kathy has the drain in her hand. When the physician gets oh, I almost forgot. One other very important piece is that you need your there has a Christmas tree or a 5-way on it already. Make sure you have one. If for some reason it gets lost, you'll need to make sure you get another one so that you connect your tubing to the trocar. Once the tubing and the trocar are hooked up, you're going to need to secure that so that if somebody steps on it, it doesn't come disconnected and you lose your water seal. The best way to do that is to take silk tape, tear off a piece, flange both edges so that you have a spot that's not sticky, and then you are going to place it between the trocar and the tubing itself, and then wrap it around it. Make sure that you have a good tight seal, and then that way, if for some reason somebody trips on it, it gets pulled while going over to the CT table, it maintains a good secure attachment. Some people say, well, what if I have to travel with my patient and it's supposed to be the suction? It's okay to turn off the suction, or not turn off, but disconnect the suction from the device. It will maintain that 20 centimeters of suction. I'm not sure of the time anymore. It can be anywhere from 30 to 60 minutes. If it's a big concern, they can hook it up when they get over there. But if it's going to be less than 30 minutes, I would not be worried about it. It will maintain that suction. The last piece is once it's all connected and the physician has it inserted into the patient, you're going to need to apply your dressing. Every physician has a little bit of a different preference as to dressings. Some use Vaseline gauze. A lot of them do not anymore. They may just place a 4x4 dressing over the site, and then you're going to use the Durapur perforated tape. It stretches nicely. It has pre-perforated lines in it to create a nice seal on there. But you want to make sure you get it completely covered and secured to the patient. That is how to set up a chest tube and apply your dressing.